Hi, I'm Tabitha Moldenhauer, broker with Benefit Consultants Midwest. If you haven't already, please take a second to hit the subscribe button. We have new helpful Medicare content every week. Today we're talking about the Medicare Part D late enrollment penalty. Medicare Part D is prescription drug coverage. It is not an automatic or mandatory part of Medicare. You don't have to enroll in a Part D plan if you don't want to. However, if you do not enroll in a Part D plan when you are first eligible, but then choose to enroll later, you may have some steep late enrollment penalties that you will pay every month for as long as you have Part D coverage. After your initial enrollment period is over, if you have a stretch of 63 or more days in a row without being in a Part D plan or having creditable coverage, and you later enroll in a Part D plan, you may owe the Part D late enrollment penalty. Medicare calculates the penalty by multiplying 1% of the national base beneficiary premium, which is $33.06 in 2021, times the number of full uncovered months that you didn't have Part D coverage or creditable coverage. The penalty amount is then rounded to the nearest 10 cents and added to your monthly Part D premium. Here's an example. Let's say someone's initial enrollment period ended on May 31st, 2017. She doesn't have prescription drug coverage from any other source, and she didn't join a Part D plan or get Part D coverage through a Medicare Advantage plan with Part D coverage. And instead, she waited and joined a Part D plan during the open enrollment period that ran from October 15th through December 7th of 2019. This means her drug coverage was effective on January 1st of 2020. Since she was without creditable coverage from June 2017 through December 2019, her penalty for the year 2021 is 31%. That's 1% for each of the 31 months that she didn't have coverage of the $33.06, the national base beneficiary premium for 2021. That works out to $10.25 per month. Since the monthly penalty gets rounded to the nearest 10 cents, the actual penalty is $10.30 per month, which gets added to her plan's monthly premium. The penalty goes up as premiums increase. You can't expect to pay the same amount for a penalty every year. So what are some ways to avoid this penalty? Creditable coverage that avoids the penalty can be through your group employer health plan or retiree plan, the VA, and other sources. It is important that you check with your benefits administrator to find out whether your current prescription coverage is considered creditable coverage by Medicare. If you have creditable coverage from another source, you do not have to worry about paying the Part D late enrollment penalty if you don't enroll in a Part D plan when you are first eligible for Medicare. It is vitally important that you save the documentation that proves that you have creditable coverage. Certificates of creditable coverage are commonly requested from health plans, and yours will provide one for you easily. Medicare plans and brokers cannot provide proof of creditable coverage at any later date. It has to come from the source of the creditable coverage. If you qualify for extra help, you will not have to pay the late enrollment penalty even if you did not have creditable coverage. I'll add a link below in the description to more information about qualifying for extra help. If you owe a late enrollment penalty, a Part D plan will inform you of that after you've enrolled in the plan. If you are charged a late enrollment penalty but don't believe that determination is correct, you can request a reconsideration from your Part D plan within the first 60 days after they've notified you that you have to pay the late enrollment penalty. By law, the late enrollment penalty is part of the plan premium. So you cannot skip paying the late enrollment penalty without possibly being disenrolled from your Part D coverage. What if you don't take any medications and you don't have any other creditable coverage? We run into this quite a bit with our clients who are younger, just turning 65 and are not on any medications. Well, you have some options. You can go without Part D coverage and plan to self-fund for the time that you're on Medicare, knowing that if you choose to enroll later, you will have that Part D late enrollment penalty to deal with. Or the other option, the one that most people choose, is go with the least expensive Part D plan in your area. In most areas, there are plans that have premiums for less than $10 a month. And that will provide you protection from having to pay that late enrollment penalty in later years. And it also does give you prescription drug coverage. So in case your medication needs change during the year, by enrolling in a plan when you are eligible, you will also get that coverage as well. I hope that helps to explain the Medicare Part D late enrollment penalty. If you do have any questions, please reach out to our office, either by email or calling 877-312-1414, or visit our website, bcmwi.com. Have a great day.